video first. I'm so sorry. My name is Marty Mascari. I'm with the North Central. I'm a contractor with the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center, both of which are under the umbrella of the North Central Texas Council of Governments. We're very, very blessed to have a group of our partners and cohorts with us today to talk about dementia-friendly North Central Texas and East Texas. But before we get started, I want to go over the CEU requirements for those of you that are joining us for looking for CEUs. The CEU requirements for today, first of all, by joining us today, it's good for 1 hour of CEU credits. We are set up to provide CEUs for licensed social workers and licensed professional counselors in the state of Texas. Now, for all of our seminars, we have people that join us with other licenses within Texas and for licenses outside of Texas. You're more than welcome to go through the process and get a certificate and submit that to your jurisdiction or whoever's over your license and see if they'll take it, but there's no guarantees. Understand, please, that we are only set up for these. We also offer certificates of attendance. The guidelines are the same for both. In order to qualify, you must attend the entire live webinar. You must not miss more than about 5 or 10 minutes of the webinar to qualify. You must also complete the Google survey. The evaluation survey should pop up as you log out today. If it doesn't, I realize some companies and people have pop-up blockers. You will also receive that in a follow-up email later today. The survey will be up for 1 week from today, and then give us about 3 weeks, 2 to 3 weeks to get those certificates out to you. And if you don't get it by then, feel free to reach out to me and we'll check into that. So in order to get started, I'm going to introduce Donnie Green, who is my boss with the Area Agency on Aging. She is the Director of Aging at the North Central Texas Area Agency on Aging and the North Central Texas Aging and Disability Resource Center. Donnie, I'm going to turn it over to you.
Thank you, Marty, and thank you all for joining us this morning. So the information we're going to be talking about this morning is the culmination of many, many months of planning. We're going to be talking about the Dementia-Friendly North Central and East Texas Initiative, which is a project that serves a broad swath of the state of Texas and really speaks to a critical need for community-based services. And that really is our focus. We want to expand supports for persons with dementia as well as their unpaid family caregivers. Joining me as presenters this morning are Yvonne Uquiles. I'm not sure I pronounced that correctly. My Spanish is subpar after 4 introductory Spanish classes, Stephanie Taylor and Jamie Cobb Tinsley. And I'd like to share a little bit of information about each of our presenters. I'll kick off and then Yvonne will follow me. She is the bilingual program manager and dementia care specialist for the Alzheimer's Association North Central Texas chapter. Yvonne earned her master's degree in counseling. Following Yvonne will be Stephanie Taylor, who has been executive director of the Alzheimer's Alliance of Smith County for 7 years. Prior to that time, she spent a decade with the Northeast Texas Public Health District as the Director of Community Outreach and Public Information Officer. She's very mission-minded, serves as a community volunteer and board member for several organizations, including the Junior League of Tyler, National Charity League Tyler, Tyler ISD Education Foundation, Texas 211, Make-A-Wish East Texas, American Heart Association, and American Cancer Society. She is a proud alum of Baylor University and Sikkim Bears. Following Stephanie will be Jamie Cobb Tinsley, who is Vice President of Dementia and Caregiver Education at James L. West Center for Dementia Care. Jamie is a certified Alzheimer's educator and Montessori dementia care professional. She's been working with persons with dementia and their family members for over 15 years. Since Jamie has been at the West Center, she has developed and implemented a variety of innovative programs, that focus on enhancing the quality of life for families living with Alzheimer's disease and related dementias. I will open up the program today, and I've been with the North Central Texas Council of Governments and responsible for our Area Agency on Aging and Aging and Disability Resource Center since 1996. Prior to that time, I worked in hospitals, starting up a hospital-based senior membership program, worked as a geriatric case manager in Parkland Hospital's emergency room, and managed a group home for adults with intellectual and developmental disabilities in Wisconsin. And I am a gerontologist by training. I've been doing this work for a little over 30 years. But I am also the child and grandchild of dementia, so really have a huge stake in this topic, both professionally as well as personally as well. So Marty, it looks like my titles are scrolling, so we may need to advance a couple of times. This project will serve a 28-county area, which is the greater Dallas-Fort Worth area, as well as the East Texas area. Why this topic matters, when we took a look at the statistics a little over a year ago, I learned that there were over 122,000 people in that 28-county area who were living with dementia. And the vast majority of people living with Alzheimer's are in the community as opposed to living in nursing homes. With dementia, as with many other health conditions, there are marked health disparities. And this condition does have a disproportionate impact on certain racial minorities, including African Americans as well as Latinos. That's due in part to underlying health conditions, cardiovascular issues, diabetes, which elevate risk for dementia. And family caregivers face some unique issues as they care for people with dementia. And among family caregivers of persons with dementia, depending on the study, somewhere between 2/3 and 3/4 are dealing with depression. And this caregiving experience creates risk of premature death as well. So as much as I believe in paid services through our agency, through our partners, the vast majority of care is provided by unpaid family caregivers. So we want to do everything in our power to support them, to prop them up, in order to improve quality of life, both for the person with dementia as well as for the caregiver. So just a little bit of background, our agency applied for a grant through the Administration for Community Living, and communities as well as states could apply. And for that particular solicitation, we were one of 10 applicants selected for funding. The project will expand services for people with dementia and family caregivers during the next 2+ years. And the reason I say plus years is we got a very, very slow start. And so it's likely that many or all of these services will be extended for at least a few months. As I mentioned, the project will serve a 28-county area, including all of the greater Dallas-Fort Worth area. It cuts across several area agency on aging service areas. And through our partnership with Stephanie and the Alzheimer's Alliance, this is really our first opportunity to be able to support services that are provided in East Texas and 12 counties in the greater Tyler area. It is important to note, however, that services will vary somewhat, and I'll share more about that as we start talking about specific services. So through this project, we'll be working with several partner organizations, the Alzheimer's Association, Alzheimer's Alliance, Community for Permanent Supported Housing, Dementia Friendly Fort Worth, James L. West Dementia Care Center, Parkland Health System, as well as Baylor Scott & White, which is our evaluation partner. Through this project, we will target historically underserved populations, including people with low incomes. Low income can affect access to care. The incidence of dementia is greater among those with limited education. We'll also be targeting those with limited English proficiency, those who live in rural areas, as well as people with intellectual or developmental disabilities who may be at risk of dementia. However, it's important to note that services are not limited to these groups. So through our caregiver supports, income does not matter, race does not matter, come to the table. I'd like to start by talking a little bit about what we're going to be offering people with dementia. And this is one of the services where there will be more variations depending on the service area. So we are not paying for these services through the Dementia Grant. We're actually funding these through our Area Agency on Aging. And it's important to note that Area Agencies on Aging all have care coordination services in the state of Texas, but the specific services, the duration, the screening criteria do vary from region to region. So, but in terms of the service itself, care coordination is a short-term program, pays for goods and services that aren't funded by insurance. And those services are provided to qualifying people age 60 and over. Again, just note that services in Dallas County, Tarrant County, and East Texas are going to be a little bit different. I'm going to be talking about these services in North Central Texas, which I define as the 14 counties surrounding Dallas and Tarrant. Marty? Okay. So in terms of eligibility for the North Central Care Coordination Program, we have 5 screening criteria that we've developed. Currently, people have to meet any 3 of these 5. So we target people who have low incomes, which we define as being below 150% of the poverty level. We also target those people who need assistance with 2 or more activities of daily living. Those who've been in a hospital, emergency room, rehab facility, or nursing facility within the last month, or individuals with behaviors that pose a danger to themselves or others. For example, somebody who's wandering, someone who, is starting fires. We also target those with a diagnosis of Alzheimer's disease, any dementia, memory problems, confusion, or chronic physical or mental illness. And finally, we target those who have no help from family or friends, although they can be receiving home health services. So again, the North Central criteria, folks need to meet any 3 of those 5 criteria. For those people who do qualify, our care coordinators will authorize a flexible bundle of services, which can include building wheelchair ramps, installing grab bars, widening bathroom doorways. We'll pay for medical and equipment and supplies not covered by insurance. So we do a lot of bathroom equipment, transfer, benches, shower chairs, elevated toilet seats. If there's somebody who doesn't have insurance, we can purchase wheelchairs, walkers. Our agency funds both housekeeping as well as personal assistance services. We provide very limited financial assistance, typically help with a utility bill. We'll pay for the emergency response services, home delivered meals. We'll also pay for microwaves, refrigerators, window air conditioners as well. We offer similar services for family caregivers, again, through our Area Agency on Aging, apart from the grant. And like the Care Coordination Program, the Caregiver Support Coordination Program is short-term. Again, please note that the services, the screening criteria, the duration will vary from region to region. And if we can go to the next slide. In terms of eligibility for these caregiver support coordination services, we can serve people of any age who care for an older adult, people of any age who care for a person with dementia, even if that person with dementia is under the age of 60. We can also serve people who are at least 55 years old and caring for adult children with severe disabilities. And we also serve those who are at least 55 years old and have primary care of minor grandchildren. And yes, the slides will be available and you can certainly print them off. Our screening criteria for the caregiver services are similar but different. Currently, folks have to meet at least 3 of our 6 screening criteria, including caring for somebody with dementia or confusion, caring for somebody who needs help with 2 or more activities of daily living, chronic physical or mental illness and or intellectual and developmental disabilities, caring for somebody who's been in hospital, rehab, emergency room, skilled nursing within the last month or so, or someone whose function has declined, caregivers who've had to cut back on work hours or activities because of those care responsibilities, or those who've experienced physical or emotional problems because of their care responsibilities. We target those who care for someone who has no other source of help and those who live in the same house as the person receiving care. So again, folks have to meet at least 3 of those criteria in order to qualify. The services that our care coordinators will authorize through caregiver support coordination include respite care. Again, we'll do all of the services that I mentioned under the care coordination program. So we'll do those minor home repairs that are necessary for accessibility, pay for medical equipment supplies. We buy a lot of incontinence supplies or nutritional supplements or supplies to give somebody a bed bath. We will also pay for homemaker, personal assistant services, again, financial assistance, emergency response, and we can also pay for things like home monitors for care receivers who may wander. In terms of what we're offering family caregivers, I'm going to let our partners talk more about the incredible services that are available through this project. We have 3 partners who will be providing the REACH program. You'll hear from 2 of the 3 this morning. They include the Alzheimer's Association and the Alzheimer's Alliance of Smith County. We'll also be working with Parkland Health System. Dementia Live is a program that will be administered by James L. West. The Compassionate Touch program will also be offered by James L. West. So again, I'm going to let our partners talk more about those services. One of the things we're doing through this project is compiling resources for people with dementia, family caregivers. We have started to create an online resource directory, and the link is in the slide. And then we also have a shorter version that's available in hard copy format for those folks who may not have internet access. Through the grant, we have money for printing. If you're a professional and you provide services face-to-face to clients, and they could benefit from those resource lists, just let us know. We'll provide you the document after the webinar today, but again, if you want us to print those in bulk and mail them to you, we'd be happy to do that. So we will be offering new services through this project in the next few months or so. One of the new services that we'll be rolling out shortly after the new year will be the Building Better Caregivers program. We have a bilingual educator who will be offering that program, and that's a workshop that brings together small groups of participants 8 times. They get information about caregiving, and then they problem solve as a group. We'll also be working to train parents of children with intellectual and developmental disabilities on aging, dementia, and resources. That will roll out shortly after the new year. And then starting at the end of this year, we will start providing dementia training to professionals, and we'll be using the Dementia Live program that Jamie will talk about in just a few minutes. So if you all would like to make a referral, please give us a call at 1-800-272-3921. And I've noted the staff members who can provide more information about the project. But if you're interested in REACH or Compassionate Touch or Dementia Live, you can certainly contact our partner agencies directly as well. So at this point, I am going to turn the program over to Yvonne, again, the bilingual program manager with the Alzheimer's Association North Central Texas chapter. And she's going to share some general information about the REACH program as well as other services available through the association. And yes, we will be sending the links for resources which are actually embedded in this PowerPoint presentation. So thank you all.
Good morning, everyone. Just making sure you can all hear me. Can you all hear me okay?
We can hear you. And I'm sorry, I believe I've misspelled your name, and I am very sorry. Boy.
That's okay. I appreciate you noticing that.
I'm so sorry.
No worries. It's a common mistake. Well, yeah, thank you, everyone, for being here today. Again, my name is Yvonne Uquillas. I am, as mentioned before, one of the bilingual program managers and dementia care specialists. So with REACH, I'll give you just an idea of what REACH is and then what my responsibilities are. It is intended for caregivers whose loved ones are at home and are not in a long-term care facility. A diagnosis of dementia is not needed to qualify for the program and is also not Alzheimer's only, despite the acronym that we use. A caregiver must provide at least 8 hours of care per week to be eligible, but this can include managing finances, appointments, grocery shopping, house chores, etc. It does not need to be physical care. So just, keep that in mind. It can be a nephew or a niece who's picking up groceries and helping with bills that add up to 8 hours a week. The caregiver and the person living with dementia, they do not need to live together. And one important facts about REACH is an evidence-based program. It has been shown to decrease caregiver depression and burden. It increases confidence, social support, and self-care for caregivers. And we are able to grab and collect this data because we do a pre and a post assessment and make sure that it reflects the work that we're doing. It is free of charge. Is 6 months. We like to do 1 visit per month. Now that I am on part of the team, Spanish is an option. So right now we're getting a good amount of Spanish speakers who are caregivers. It depends. It could be in person. It could be over the phone. It really depends on the dementia care specialist and the caregiver. Let's see. We do have a referral form. We have one that comes out of the agency, whoever is working with the caregiver. We also have a self-referral form. So if a caregiver comes across our information or you yourself notice that someone would benefit from our program, we do have that as well. And so that's the overview of REACH. And we have a notebook that we use. It's more of a guide. It's a guide so that the dementia care specialist and the caregiver can work with together. So here is a visual of what the notebook looks like. We have different tabs on the side. So just to give you all an example, we focus on home safety, managing stress, healthy living. So we really want to make sure, as you all know, that the caregiver is taking care of themselves so that they can continue taking care of their loved one. And In my time here at the association, I am learning the need to bring the caregiver back to themselves and just have that 1 hour to really process everything that's going on in their lives. I think that's all the information I have. Dani, if am I missing anything? Anything else that you would like me to talk about?
Perfect. Yeah. Anything else that you'd like to add about other services through the association?
Yeah, one of our main resources is our helpline. So 24, and I tell this to caregivers, if I'm not available, know that someone is. So at 3 a.m, you have a loved one who is pacing back and forth, is very stressed, and you don't know what to do. Our hope is that you never feel alone. So having this helpline, it's that 1-800-272-3900. And my coworker GJ was able to add that in the chat for you all. That's, I think, one of our main resources. We do have online and in-person education programs, and then we have online and in-person support groups as well. Thank you, Dani.
And then just a quick question. So the question is whether services are available in other states, including California. And the Alzheimer's Association has a presence nationwide, but the REACH program, Yvonne, I believe is really unique to you all, correct?
That's correct. So like you said, the Alzheimer's Association is nationwide. We are in majority of the states, but the REACH concept and our REACH program, we're the only chapter that has REACH.
Thank you. Excellent.
Thank you.
Thank you, Yvonne. And now we will turn it over to Stephanie with the Alzheimer's Alliance of Smith County.
Hey, good morning. Thank you so much for your time this morning. I know in East Texas, we're excited to be part of this and really expand these services out into our rural communities. And Yvonne did a great job of explaining the REACH program. The Alzheimer's Alliance of Smith County is a local and independent nonprofit. We've been serving here in Tyler for 40 years. This is actually our 40th anniversary. So we've been providing services for a really long time. And several years ago, another local board put together an Alzheimer's Alliance in Gregg County, which is the Longview area. And so really those are the two programs that operate in the East Texas area. We have some other local coalitions, but they're not formed as actual organizations. And so that's our area agency on aging coverage area. And so we will also be providing the REACH program. We were introduced to the REACH program several years ago, but once we were able to receive this funding, we've now been able to train almost all of our staff here as certified on the REACH program. Dementia care specialist is what the certification is called. And so we're really excited to expand that program. We're very limited on that now, but with training our new staff, we can expand that. We also trained the staff in the Gregg County Longview area and in our area agency on aging office. So we're really excited to expand this caregiver support program. And there's a picture of the caregiver's notebook as Yvonne held up and showed you. And then also we have brought on staff a bilingual counselor who will be able to expand our REACH program to any of our Spanish speaking population. So we're really excited to be able to expand in that way. Some of the other services other than REACH, one of the things we're going to be focusing on, you can go to the next slide, is our professional caregivers. So we are really doing some inpatient hospital trainings with bedside nurses, our case management and social work staff here. You know, Tyler is really a hub for medical care. And so we want to really focus in on professional development and professional training as it relates to Alzheimer's care through this project. And so we actually have our first training coming up with nurse leadership at Christus. And the great thing about that is that then they can take that information and spread it throughout their clinics and the inpatient setting. So a lot of great opportunities coming up for our medical professionals who are caring for someone with Alzheimer's or related dementias. And then outside of this particular project, some of the services that we offer, and you can go to our next slide, just in general, over our 40 years, we provide respite care in-home and institutional respite. Our institutional respite is through a partnership with the East Texas Area Agency on Aging. We also manage 5 support groups at our facility in-house, and then we partner with other support group leaders for 8 other support groups, and then of course we refer out to support groups across the entire 14 county area. We have a social worker, a counselor, 2 counselors on staff that provide case management and counseling services. We also have an educational workshop for caregivers in addition to our REACH program. That happens at least once a month, sometimes twice a month, where we tackle just various topics that have come up through our REACH services or through our case management services. Some of those might include elder law, end-of-life care and palliative care. We've had topics on the driving conversation when it's time to have the important driving conversation. So various topics of that nature. We also administer our Project Lifesaver program. That program is in place in several East Texas counties. That's a program for those who may wander, and it's in partnership with our sheriff's office in the respective county that program is in. And that's a nationwide program. I know somebody asked about California earlier. So you can go on the Project Lifesaver International website if you have people who have a tendency to wander, and see if that sheriff's office across the nation is a participating entity. So that's a great resource nationwide. And then we have our day respite program we've been doing for about 25 years. We do that 2 days a week. And so that's a dual program for those living with moderate stage disease process, Alzheimer's or related dementias. You know, it is evidence-based and proven that those day respite program allows someone to stay in the home longer and to have an increased quality of life over their disease span. And so we've been doing that program for a really long time. And then the flip side of that is it's also a respite program. And so we're able to offer caregiver respite during the day, those 2 days a week. So that's a little bit more about our programs and services outside of this grant. We do have referral forms available, and we are working on getting those referral forms on our website so that you can just make a web referral and it goes directly to us really easily. But in the meantime, you're welcome to contact us anytime with any questions or any referrals in the East Texas area.
Fantastic. Thank you, Stephanie.
Thank you.
And now I'd like to turn it over to Jamie Cobb-Tinsley with the James L. West Center for Dementia Care.
All right. Thank you, Donnie. Good morning, everyone. The James L. West Center for Dementia Care, we are a nonprofit organization that services all persons impacted by dementia. here. We are located in Fort Worth, but we don't have a geographic boundary. We do that through a variety of services. We are a long-term care community. We also offer a day program, much like Stephanie talked about, that they do as well. And then, of course, there are education, which I'm going to dive in deeper here with you all. But we have a robust education department that we do for families, the larger community, healthcare professionals, just to help us better understand dementia, learn best practices, hopefully get rid of that stigma that's around it, and really just support everybody through the journey that they have. So there's a lot on this slide here. I apologize, but the first program listed, and it's been mentioned already, is Dementia Live. And Dementia Live, it's an evidence-informed program, and it's a simulation program. So this is a hands-on experience that people get to do to really understand what it's like to live with dementia. The goal is, if I can put myself in the shoes of somebody with dementia, I can provide better care, problem solve, and have more empathy for those individuals. And this powerful program really allows for that. There are things that are put on you that limit senses, create confusion for a healthy brain. And then you are tasked with doing some tasks while you have those limitations on you. And then after your experience, you talk about how that affected you, and how you responded within the experience, and how we can take your experience and do things differently for persons with dementia. We do this, of course, we want everybody to go through this experience, whether you're impacted by dementia or not, because we all need to know. But of course, family members, and healthcare professionals. So part of this grant, we will be able to provide the experience for anybody that wants to do the experience. But we're also going to be able to train others to facilitate that experience. So whether you're a professional, maybe you're in a community or at a hospital, and you want to be able to take this program to your community, to your families, and we're going to be able to do a train the trainer with this. With that, you get a year license to be able to facilitate this program. Really, and I love this part of it, because you just get to teach. We get to teach more people and raise awareness, and just create a deeper understanding of what dementia is and what it isn't, and how to provide better care. So 2 things we can do with this. The other great thing about Dementia Live is it's very flexible. Obviously, you want to do it in person if you can, but there are some virtual options as well, which are just as effective and powerful to be able to experience and have that understanding of what it might be like to live with dementia, and of course, provide better care. And then we have Compassionate Touch. Compassionate Touch is also an evidence-informed program. And this program really targets persons with dementia, but also people at the end of life. In this technique, it's really a care technique that can be taught to anybody, families, healthcare professionals, about how to provide communication through a form of compassionate touch. So there is a hand technique, a back technique, and a foot technique that are taught, real easy to learn, real flexible, on how to provide just specialized skilled touch, essentially, but also combined with mindful communication. And as we're using this care technique, what it really does is it creates connections between the care receiver and the caregiver on just, there's 2 human beings here. It helps us look past the disease. It helps us look past potential behavioral expressions, and then just really be able to connect with that individual. It's been shown over and over again to decrease depression, decrease agitation and anxiety, and help with managing and easing pain. And this can be physical pain, but emotional pain, mental pain, social, spiritual pain as well, that we all, live with. And this, because what it does is, at the end of the day, it helps us be able to communicate that I care about you. All of us that are working with or loving or living with somebody that has dementia, we communicate all the time that I care for you. But this is just an extra easy tool for anybody to learn to communicate that I care about you, and create just meaningful and deeper connections with that individual. Great program. Some other programs, before I move on, sorry, with Compassionate Touch, obviously, the training can be done in person, but it can also be done online as well. So we're able to get a larger audience and teach this care skill so it can just be disseminated out to the whole world, hopefully. Some other programs that we are doing in partnership with the North Texas Council of Governments is the stress busting for family caregivers of persons with dementia, but also caregivers of persons with chronic illness. And this is an evidence-based program. And it meets, it's weekly for 9 weeks. It's a 9-week program. It does come with the workbook that caregivers get to work through. And it really focuses on how the caregiver can do self-care. So there is a whole week, a whole chapter that we talk about how do you manage and understand more about whether it's Alzheimer's and dementia or it's chronic illness. But the rest of it's how do you as a caregiver work through the stress, and develop better coping skills so you can provide better care to that individual, to your relative, the person you love, because you're taking better care of yourself, but also help you just kind of change how you perceive your role as a caregiver, work with other changing roles within your life, whether it's the family or at work or anything like that. And it's a small group that meets over 9 weeks. So not only is there that educational component that comes with it, but there's also kind of a built-in support group component because it's that small group that meets together for 9 weeks and share their experience. And of course, connections are made during that process. And then that last program I will mention here is our Dealing with Dementia program. This is an evidence-informed program, and it's through the Rosalind Carter Institute for Caregivers. This is, it's a 4-hour workshop. So it's, and I wish I had the book with me, but it comes with a resource guide that's over 600 pages. And that resource guide has really been deemed, several people have said, this is my Bible. This is my caregiving Bible, because it talks about caregiving tips. It talks about, it's specific to dementia. So how to manage the changes that happen in somebody with dementia, but then all the resources that you can get as well, whether it's local or national resources. And this has been proven to not only increase knowledge of dementia, but increase confidence and a person's abilities to continue to care for their loved one. And of course, they have that book, just like Reach, the notebooks they have been showing, that they have that as a resource to come back to through their journey. And, when something happens, they can come back to that book and look through it and say, oh, okay, here's some best tips or ways or things that I can try to help to get my loved one to take a shower, or, how to change the meal time to make it more successful or happy or things like that. So it's a wonderful program that's offered, and we're able to offer it. So just a handful of programs. We hope that y'all take advantage of all of these, because thank you to Donnie and her team for getting us to get this, to be able to provide it for free, and of course out to such a larger geographic area. Thank you.
Thank you, Jamie. And that does bring us to the end of our prepared information. So I think at this point, we do have a few minutes if there are any questions from participants. I see a question, is blindness a criteria for care coordination services? So it can be a qualifying condition, but I apologize for the small type. We will get the slides to you.
Jamie, can I ask you, is the Rosalind Carter book available to people outside of our service area? Is there a way they can access that book?
There is. You have to go through the training. So for the book, like if we do an online training, you got to register beforehand, and then we ship you the book before the program starts. But we do ask that you go through the workshop. That's part of it to get the book. So, but we can ship to anybody.
Does the Rosalind Carter Institute, do they have a directory of organizations that provide the training across the country? Do you know?
I'm sure they do. And I can look into that and maybe get you a list to send out.
I'll actually look into that and see if I can include that in our follow-up email. I know there's a lot of people joining us from outside of our service area, and so I'll see if I can check on that before I send out the follow-up email.
But then, you're always welcome to join ours, because most of the ones we do are online.
Oh,
so.
nice. Nice.
Yvonne or Stephanie, would you like to let folks know what REACH stands for?
Yes, it's Resources Enhancing Alzheimer's Caregivers' Health. So, and as Yvonne said earlier, even though it says Alzheimer's caregivers, it's we serve anyone with any form of dementia. So but it's very specific to the caregiver. So it talks about things, pleasant things for you to do, how to deal with stress, how to manage your chronic illness as a caregiver. We see a lot of our caregivers have chronic illnesses that go by the wayside because they're so focused on caring for the person who's living with the dementia illness that then, and in our case, and I'm sure Yvonne sees this too, but we have a lot of caregivers who actually pass away before the person living with the dementia illness because they didn't take care of themselves. And so I think that's what's so great about this program is it focuses on the caregiver's health and how to manage that health as they are caring. So.
Jamie, there was the question about finding the information on your website.
Yes, thank you. And I was making myself a note. So most of those programs are listed under our training for healthcare professionals, but they're not just for healthcare professionals. So I made myself a note to get those also included in our education calendar. So thank you for pointing that out. We'll get that fixed. If you have any questions, feel free to email me.
So question, does it matter what stage a patient has reached with Alzheimer's? And does the program accept certain insurance? So let me take the last question first. Insurance does not come into play at all. These services are available to people with no insurance. They're available to people with Medicare. They're available to people with commercial insurance. We don't ask that information. And interestingly enough, with services that are funded through this grant, as well as services through our Area Agency on Aging, residency is not required. So through the Area Agencies on Aging, we do have the ability to serve people who, may not have legal status, who may have green cards, who may have been, born and raised in Dallas-Fort Worth. So in terms of the stages a person has reached, so I think all of these services will benefit people at all stages. Now, if somebody is in the late stages of dementia and is dying of the disease, it's probably too late for the information and support. When my dad was dying of dementia, I didn't necessarily need to learn how to deal with dementia. I just needed to learn how to turn somebody who required total care. So with REACH, there is a requirement that the caregiver is providing at least a certain number of hours per week of care. I think in general, and I'll kind of throw that to Stephanie and Yvonne. What do you see in terms of kind of stages of the condition? Is there a certain stage you target, or does that even come into consideration?
The only time it comes into consideration is how to work with the caregiver. We don't have a specific requirement of what stage the person living with dementia has to be in, but it helps us to know how to proceed with the sessions and the caregiver and their families. That way, we figure out and we work together to integrate strategies when working with their loved one.
Yeah, and so the same for us with the REACH program. I mean, we will serve anyone who is caregiving at any stage in the illness. But I would say what we've found just in piloting the program with the caregivers that we see, specifically for REACH, we really like to get people on the program earlier, when they first learned of the diagnosis, because a lot of times as they move through that disease process and, they think that they can do it with no support and they want to try to do it with no support, then when they finally call us, they're in a crisis situation. And when they're in that crisis situation, because REACH is a coaching program, it's a tool, kind of a toolkit. And so when they're in a crisis situation, you have to solve that situation before they're really open to, okay, let's talk about how we can tackle, behaviors before they begin and turn into a crisis. And so that's just what we see, and that's what we decided we'd like to target, is people who are pretty early in the caregiving process.
Mm-hmm. Yeah. There's a question about income eligibility criteria. So through the grant, there are no income restrictions. So again, we welcome the opportunity to serve caregivers who are well-resourced. Through this project, we really do want to target those people who may have low incomes because, again, the risk is greater. Oftentimes, there have been issues with access to care. And so we will ask about whether somebody's living in poverty or not through the grant, but that answer won't be used to determine their eligibility. When we provide services, care coordination, caregiver support coordination through our area agency on aging, those services are not limited to people with low incomes, but we do give priority to people with low incomes. So typically, we will buy things through that program if people have difficulty paying privately. If somebody is making $1 million a year and needs advice on what to do, we'll be happy to provide information, but we won't necessarily pay their utility bill. So that's probably the program where we would talk more about income in order just to kind of build the case that the person needs us to pay for those things because they would have difficulty paying themselves. But REACH, available to folks of all income levels, Compassionate Touch, Dementia Live. And, even if somebody wouldn't have financial need for us to pay for stuff, we'd be happy to talk with them about considerations. We'd be happy to provide referrals to in-home agencies or, whatever services they might need. Now, when we're screening people to determine if they're eligible for ongoing services, once our short-term services stop, we would drill down, we would ask about income, resources. The major programs are funded through Medicaid that provide ongoing services, and those would have strict income and resource limits, and we would talk through those issues.
It looks like there was a question about the REACH program and what care is given to the care recipient when the caregiver is going through one-on-one REACH coaching session. I know for us, a lot of times we provide in-home respite. So if someone wants to have their session in the office, we can coordinate in-home respite so that they can come. A lot of folks, they might have another caregiver available for just a 1 hour time period where, maybe it's a husband caring for his wife and the daughter can come for that 1 hour where they don't have to have, a paid caregiver come into the home, but we try to coordinate respite care. We also do some of that while the care recipient is at our day respite program. They're welcome to schedule their sessions during our day respite program. So there's a lot of different ways, and it really just depends on a case-by-case basis what the situation is on what the care recipient is doing while the REACH sessions are being provided.
Yeah, and the Alzheimer's Alliance is really unique in terms of offering those services for folks who don't live in the East Texas area, who wouldn't be served by the Alliance. Again, just keep in mind that the Area Agency on Aging has a respite program. The Aging and Disability Resource Centers also have respite programs. So, you know, in North Central Texas, you may not necessarily get the one-stop shop of both respite and reach from the same organization, but we can certainly connect people with those other resources. Quick question about what is the time frame for the short-term program. The North Central Care Coordination Program has a duration of up to 5 months, and that's the pretty typical term of service. Again, there are differences from region to region. Dallas County, Tarrant County, East Texas may have a different duration. Jamie, question, is the Dementia Live available to a caregiver's family member?
Yes, Dementia Live is available to anyone. Really, the only thing you can't do with Dementia Live is somebody already has dementia. They cannot go through Dementia Live. That would just create more confusion and agitation. But any family member, anybody that just wants to know more, anybody working with, living with, loving somebody with dementia, we highly encourage you to go through this program. It doesn't take a long time. It can be anywhere from 30 minutes to an hour. And again, we can do it in person, but there's also virtual options as well.
Great. Good.
Jamie, Dementia Live in Spanish.
Yes, thank you. Yes, we can do Dementia Live in Spanish, as well as dealing with dementia. And we could do Compassionate Touch in Spanish as well, if we needed to.
Great.
Thanks, Yvonne.
Well, I'm going to change our slide and go back over our CEUs real quick. And maybe other questions will pop up while I'm doing this and we can address them. But for those of you that are joining us today that are looking for CEUs or a certificate of attendance, we are offering CEUs to licensed social workers and licensed professional counselors in the state of Texas. If you have a different license in Texas or you have a license outside of Texas, you're more than welcome to go through the process, get the certificate, and give it to your jurisdiction. But please note, there's no guarantee they're going to take it. We're only set up for the 2 licenses in the state of Texas. Today's for attending today is good for 1 CE hour. You must complete the entire live webinar, meaning you must not have missed more than about 5 or 10 minutes of today's webinar. You must also complete the Google survey evaluation. It should pop up as you close out today of a Zoom, but if it doesn't, I realize some people have pop-up blockers. You will also receive that link in a follow-up email, along with links to the presenter slides and the handouts from today that I've posted in the chat as well. The Google survey will be up for a week, and then please give us 2 to 3 weeks after that to get the certificates to you. If you don't have it by then, feel free to reach out to me and I'll be happy to look into that for you. I want to go to the next slide real quick and just talk about a couple of upcoming related webinars. We do a lot of webinars that are free of charge, and because obviously their webinars are open to anybody, we even have a fair following in the United Kingdom and Ireland and some other countries now, but you're more than welcome to help us spread the word. We're doing in partnership with the James L. West Center, we're doing the Holidays and Dementia on November 8th. And also with the James L. West Center, we're doing communication through the stages of dementia on November 22nd. Please help us spread the word. We love to do these and have them help as many people as possible. And so if you could help us spread the word, we would be grateful for that. Donnie, was there anything else before we close out?
If we could answer a question real quickly, the phone number for the REACH program, it is different depending on the part of the state. So in North Central Texas, it's 817-336-4949. And then Stephanie, in East Texas, I don't have your number memorized quite yet.
Our number is 903-509-8323. I'll type it in the chat.
Stephanie, and okay, great. I was going to say, Stephanie and Yvonne, if you guys could email the phone numbers you'd like people to use, I will include those also in the follow-up email to everyone.
Perfect.
In addition to that, I want to let you know we are recording today's webinar. It will be available along with most of the other webinars we do on our YouTube channel. You'll find a link to that, the YouTube channel at the bottom of my email that I send to you. It's in my signature, but you'll also, everyone who registered for today will receive a second follow-up email that will have the link to that recording in it once we get it up to YouTube. Well, I want to thank you all. Donnie, thank you so very much, Donnie, for putting this together. Not only that, for doing all the work to apply for the funding to be able to offer the dementia-friendly in our service area. I want to thank Stephanie and Yvonne and Jamie as well. Thank you all. We've had lots of compliments in the chat. Incredible job. And thank you all for joining us today, and I hope you all have a wonderful day.
Thank you. Thank you, Donnie.
Thank you.